I still remember the day my own grandmother started forgetting our names. At first, we thought it was just normal aging, but when her neurologist reviewed her medication list, something unexpected came to light. One of her daily pills had been linked to increased dementia risk in multiple studies. This personal experience led me down a rabbit hole of research that changed how I approach brain health forever. Anticholinergic medications, a class of drugs used for treating various conditions, including allergies, depression, and bladder issues, have been identified as potentially problematic for long-term brain health. These medications work by blocking acetylcholine, a crucial neurotransmitter involved in memory and learning processes. A landmark study published in JAMA Internal Medicine found that people taking strong anticholinergic medications daily for 3 years or more had a 54% higher risk of developing dementia compared to those who took none. This isn't just alarming, it's information that could transform how we approach medication management, especially for older adults. The scientific mechanism is fascinating yet concerning. These medications can reduce acetylcholine activity in the brain, potentially leading to cognitive difficulties. Additionally, some research from the University of Washington School of Pharmacy suggests they may promote inflammation and the formation of amyloid plaques, hallmarks of Alzheimer's disease. Common medications with anticholinergic properties include certain antihistamines, particularly first-generation ones like diphenhydramine/Benadryl, some antidepressants, particularly tricyclic antidepressants, specific bladder medications, certain sleeping aids, some over-the-counter cold medication. The risk appears dose-dependent, meaning higher doses and longer durations of use may increase potential cognitive impact. However, it's crucial to understand that these effects vary significantly between individuals based on genetic factors, overall health, and other medications being taken. Dr. Shelley Gray, the lead researcher from the University of Washington study, emphasizes older adults should be aware that many medications, including some available without a prescription, such as over-the-counter sleep aids, have strong anticholinergic effects. What makes this particularly troubling is how these medications are often taken long-term and sometimes without regular medical review. Many people don't realize their sleeping pill or allergy medication could potentially affect their cognitive health years down the line. But before you panic and throw away your medications, let's be clear, the relationship between these drugs and dementia is complex. Correlation doesn't necessarily mean causation, and for many people, the benefits of these medications may outweigh potential risks. Here's what practical steps you can take. 1. Review your medicine cabinet. Make a list of all medications you take regularly, including over-the-counter drugs and supplements. 2. Consult with healthcare professionals. Schedule an appointment with your doctor or pharmacist specifically to review your medications for anticholinergic properties. 3. Never stop medications abruptly. Stopping prescribed medications without medical supervision can be dangerous. 4. Explore alternatives. For some conditions, alternative medications with fewer anticholinergic properties may be available. 5. Consider a medication holiday. Some doctors may recommend periodic breaks from certain medications when appropriate and safe. 6. Prioritize brain-healthy habits. Regular exercise, cognitive stimulation, quality sleep, and a Mediterranean-style diet may help support brain health regardless of medication use. Tracking your cognitive health is also important. Simple measures like keeping a symptom journal, taking periodic memory assessments, or even using cognitive training apps, can help you notice changes early. Share any concerns with your healthcare provider promptly. Remember that individual risk factors matter tremendously. Age, genetics, other health conditions, and lifestyle all play significant roles in determining your personal risk for cognitive decline. I want to emphasize, this information isn't meant to frighten you, but to empower you. Knowledge about potential medication effects allows you to make informed decisions alongside healthcare professionals. My grandmother's story had a positive turn when her doctor adjusted her medications, substituting the problematic one with an alternative that managed her symptoms without the anticholinergic burden. Within months, we noticed improvements in her alertness and memory, not a complete reversal, but meaningful progress that improved her quality of life.